and more effort and more maybe strength of the platforms to actually support it. Interactions with content can be made easier, less prone to errors by presenting tasks in steps that are easy to follow. Now, these are all rules. Anybody wanting to develop digital tools, especially for persons with disability, they'll have to follow a lot of these kind of guidelines the government is setting. Next slide, please. So many more of this. I mean, if you just write ICT guidelines, Person with Disability Act, ICT guidelines, Persons with Disability Act, a lot of this and much more will come to you and you can mull over it. Next slide, please. Yeah. So again, many more things. So any development will have to take all these kind of things into play. Okay, next one. Again, with a lot of these things, it's about using pictures, because verbal comprehension, verbal expressions are the challenges for children with autism. How to use pictures to communicate. So a lot of even routine non-digital modes of intervention in autism uses a lot of picture-based technology. So you kind of keep the number of picture-based things for them. They'll very unerringly go and choose what they want to communicate, and they're pretty good at it. They will actually do a good job. So using pictures to help improve communication should also be incorporated into the digital mediums, right? And of course, many of these things. Other thing is, they're trying to see eye gaze sensing. It's not again, it's much researched upon, but the autism children to actually predict where their eye gaze is and what is the intent, how are they actually, what is what they are perceiving from the information given to them can be a very complex thing to predict. It's not like how it will appear very intuitively easy to understand with non-autism persons. So again, next slide. Many of these, see this picture-enabled keyboards are being created. Next slide. This is something I want you to download the app and go and look at it in detail later on. Okay, this is work led by IIT Chennai. Now a lot more entrepreneurs are adding to the IIT group and working on it. It's a picture and text-based AAC. Anybody knows what is AAC? AAC is alternative and augmented communication, augmentative communication. So if you reach a point where you think the child is not going to learn the regular kind of language, you use alternative ways to help the person communicate. Okay. So Avaz is a picture and text-based AAC app that empowers children and adults with complex communication needs such as autism to express themselves and learn. This website is extremely useful. Please go and look at it. And depending on the kind of words that the child is able to connect with using pictures, the AI system can actually make it much easier to create the kind of words that the child is more likely to respond to. So there's a lot of predictability kind of technology built into these apps nowadays. It's been growing for the last 10-15 years, but it's become, in fact, the next slide, you will actually, they are not only giving a lot of teletherapy support, next slide, they also have, they certify speech language pathologists and psychologists in the use of Avaz. They actually have a program to help professionals learn how to use the app and train the children. So they have really gone, it's pretty well much advanced. And mind you, this is coming from Indian work itself. Okay, so like I put there, it's a landmark story in the Indian disability space. There are a lot of training programs for parents and professionals, like I was telling, how to help parents learn intervention models. Okay, they are really front runners. It's still not comprehensive. All aspects of intervention are really not covered, but they have really got a head start on this journey, really. So you should all read about this Avaz app. Next one. Yeah. START is screening tool for autism risk using technology. This has been just using mobile phones. They actually use a lot of videos to pick up children who are at risk for autism, and then it's kind of connected with the company I told you, Cognable, who has done a lot of work in this area, who are developing a lot of intervention platforms. It's just to repeat what I said before the lights went out. The key thing is, based on assessments which are entered by parents answering questions, the platform is AI enabled to identify the videos which will have the training that is suitable to that child. You can imagine the varieties of videos, varieties of intervention, ability to recognize multiple behaviors that are coming on in the assessment method, connecting them, picking it up and giving uniquely to that child. You can imagine the kind of effort that's needed for that kind of a platform to work. Cognable has really got a little ahead of the group on this kind of work. So you can read up about START. You just put START and autism, you'll get to read a lot about that work. Next slide. This is another exciting work. There is one Dr. Chiranjeev Bhattacharya in Indian Institute of Science, Department of Mathematics. He is very much interested in robotics, and he's trying to use this tiny little miniature robots because the autism children seem to actually like it and they're able to connect with it. Why do you think human behavior, parents trying to interact, they're not doing the same response, but when let's say a little robotic toy does it, there seems to be a little better quality of response from autism children in compliance. That means they follow the instruction given by them. Any idea why that may be happening?
Sir, robots don't use non-verbal cues.
Okay. In fact, some of these are becoming very good at that. As AI technology is growing, they add a lot of this emotive things into that. It's very exciting to see that kind of work. But apart from what you said, which definitely has a role to play, is predictability. Now, a particular observation which is clicked by the camera within the robot leads to a particular action, and the child can be absolutely sure that's what is going to happen. You must all be familiar looking at, even healthy nephews and nieces and little babies who rapidly start learning to use apps, and you wonder how they will actually understand all this thing. Why? Because, and mind you, like some of us will be scared to try some of the things, but they will anyway explore. But once they do, they find it's predictable. If I do this, I'm sure this will happen. So while all of us need predictability, autism children need very, very high levels of predictability. So this professor works on the idea that maybe robotics can actually make them comply with instructions, and in the process they will learn lot more things than if it's delivered by a professional, a human. So, I mean, forget about all the details, but this robot now is something that he's really using a lot. And next slide, I think one is similar to that, yeah. There's a pilot study being conducted with a center called ASHA, Academy for Severe Handicaps and Autism. You have to just Google ASHA for Autism, okay? It's ASHA, ASHA for Autism, .com or .org, I forget which one it is. And you'll find all this work that they're doing with ISC on that. So they are trying to use this to learn two things. One is to improve their motor skills, and other one is to become more compliant with instructions. Next slide. Yeah, a lot more considerations. I mean, we heard about limits of technology and all that. We'll not worry about this. I'm sure some more knowledgeable person than me has spoken. Next. Yeah, a lot of awareness. Don't worry, and a lot of technology platforms have to take this forward. Next. Yeah, it's been recognized as a condition with public health importance only recently by Government of India, and they have set up this framework for providing services to them. But technology to scale up screening, and also in intervention space has been on the rise with new groups joining every year. I mean, I've attended quite a few hackathons in Bangalore where people are showcasing their little tiny IT developments. If you have 10 in that list, 2-3 will be working on autism. So I find that more and more people in the software space are very excited about developing. So if you go and give them an idea and you tell, this is what the child does, this is what I want to make it happen, and you work with them, they are really excited in preparing those kind of things. And of course, then they have to come to clinicians who have got access to large number of children to validate that work that they have done. After that, it's ready for market use. So this is actually increasing, it's increasing exponentially, and it's a very exciting area to get into. And I think time is right for multi-centered collaboration to develop models that can be scaled up across country, and probably it will apply to the whole subcontinent. Is that it? Please, next slide. Yeah, thank you. I'll stop there. I'm told I can take 1 or 2 questions.
We request you to raise your hands high so that I can pass the mic.
Hi sir, I am Maruti. Sir, my question is that what extent we can have a digital health? You mentioned the various models, right? So for the rural people, for the ASD children, because it's very difficult to access the internet because they have the minimum level of internet facilities. So what's your opinion on this?
That is a real last mile issue. I totally agree with you. I think as they develop, the demand for higher internet penetrability will have to go hand in hand. Without which, all of this is just really have no impact. That's a good point you make. Yeah, but it is. I mean, there is a with digital India and so much of push by the government. It's expected that this divide will be constantly the gap will be reduced in the coming years. True. And also, if the community start hearing that this method is working for them in, let's say, it's working for them in, let's say, it's working for them in Gulbarga, why can't it work in Shahpur or, Yadgir, that pressure will come. And I think once the citizens start seeing that it is possible, they'll put pressure on having access to that. But definitely right now we need to develop the models and show that it works. But I totally agree with you. Internet penetrability is something which has to go hand in hand. Yeah.
So one more question. When we deal with patients face to face, we see there are so many no-shows. They are not coming up for the therapies, any kind of therapies. So in this digital thing, how much will be the success rate?
Very true. COVID taught us few things, some harsh, some useful things. Yeah. So it's not always easy. One of the problems I'll tell you with this thing, it all sounds exciting. And for a planner, if I say by doing this, you can bridge the gap. So many poor people, like Dr. Reddy was talking about, highly regions, you suddenly say everybody becomes accessible. The thing is, it's one thing in a center for the staff to sit with the child and do the intervention. It's very labor intensive, you know that. And to make the parents do that, apart from caring for the child all the time, which is what COVID taught us, was the limits to online therapies really. Because that same parent has to get into the therapy mode during that fixed time, actually do so much hard work with the child. Okay, so apart from, of course, logistics of maybe coming, or like he said, use of technology, even if it's available. So I know there are going to be limitations to this. Yeah, we are talking right now much ahead earlier in terms of having models that can possibly work.
But then this will not increase the stress of the parents as well.
It will, yeah. But the choice for them, and sad choice for them, and which we are conscious of, which will probably get more spelled out once we have this, is you do it. If you can access, go there and access a professional. Otherwise, do at least this. So parents will face some crisis. Some of them will manage, some of them will not. And technology has to come. Then we'll see how to further help these parents. This cycle will go on. I'm sure a lot of parents will feel burdened thinking, see, somehow they're able to do, somehow they're not able to do. We'll expect then the nurses in the DICs to think, why these two parents are doing well, this is not doing, and see if there is some other social or mental health concerns in that family which is stopping them from doing it. So a lot, it's not definitely as one-to-one as putting it at first glance. There will be multiple layers like this to cross through. Thank you. Thank you.
So I would like to extend my heartfelt gratitude for throwing light on the various challenges that one needs to come across while developing a digital model. In fact, certain decision-making issues that you had pointed out, like the kind of equipment that needs to be used, it shows the keen eye to detail that we need to have while developing digital interventions. Thank you so much for an insightful presentation. I invite Ms. Monica to present Sir with a memento in appreciation and gratitude. We now move to the final keynote session of the day, for which I invite Dr. Navya to introduce our esteemed resource person.
Good afternoon, everyone. Welcome back. Moving on with our sessions, the next speaker for the day is Dr. Shahul Amin. He's currently working as a consultant psychiatrist in St. Thomas Hospital, Changancherry, Kerala. He passed his MD in psychiatry from Central Institute of Psychiatry, Ranchi. He has over 660 publications and is the editor of the Indian Journal of Psychological Medicine since 2017. He was also the previous editor of Kerala Journal of Psychiatry, and he is also the co-editor of the book, A Primer of Research, Publication and Presentation, now in its second edition. Dr. Shahul is also the author of the e-book, A Companion into Fish Psychopathology. He has also written more than 200 mental health related articles in Malayalam periodicals. And in 2013, he was elected for the Early Career Psychiatrist Program conducted in Colombo by the Asian Federation of Psychiatric Societies. In 2015, he was selected for the Young Health Professionals Track in relation to the International Congress of the World Psychiatric Association held in Bucharest, Romania. He was also awarded the Certificate of Excellence for Best Case Presentation at the annual National Conference of Indian Association of Private Psychiatry in 2013. Today he is here with us to speak about how to get our articles published and the best ways to avoid journal rejections. With great pleasure and honors, a warm welcome to you, sir. The stage is all yours now. Thank you, sir.
You are changing from there. Please go back to the previous. So good morning, everyone. At the outset, I would like to thank the organizers, Dr. John, Professor Rajkumar, Vismaya, Mona, and all for the opportunity and the hospitality. Next slide, please. You can download my slides from this link, mind.in/rejection. It is actually PDF because of the compatibility issue. It is not coming. The entire slides are there. Mind.in/rejection.pdf. And many of you are from Kerala. For those of you who want to read those 200 plus articles I have written on mental health, you can visit the main site, mind.in. All the articles are available at the link. Next, please. So this is the journal I have been editing for the past more than 5 years, Indian Journal of Psychological Medicine. It is the official journal of Indian Psychiatric Society South India Zone. Currently it is in the Scopus Q2 category in clinical psychology, and it is the first and only journal on mental health from India to enter the Scopus Q2 category. Before proceeding further, I would like to know how many of you have published in a peer-reviewed journal? Please raise your hands. Not necessarily a 1, 2, 3, I think. Okay, so I think it will be what I will talk in that level only. Next slide, please. So basically, I will be focusing on the rejection part. When you submit an article to a journal, the rejection can happen at 2-3 levels. Like first, when you initially submit, all the articles will be screened by the editor or one of the teams of the editorial board, assistant editor, associate editor, etc., etc. Next slide, please. Next. So they themselves can reject your article without sending it for peer review. Suppose because of various reasons, it is not novel enough, the language is very bad, it is out of scope, etc., etc. So it is called desk rejection. Or if they feel that it is good enough, then they may send it to a set of experts who are called peer reviewers, and who will go through them, and they will give their recommendation to the editor whether to accept the article or whether to reject the article or whether to ask you to revise the article. There can be two kinds of revisions. One is the minor revision, where like you are asked to make some subtle changes only, or it could be a major revision where you have to do a lot of things, maybe collect more data or write the entire introduction or discussion section, or maybe do a lot of new analysis and all. So next please. Even after that, there can be a rejection. So suppose you have done your revision, a major revision, and submitted back, But even after that, the reviewers and editor may feel that it is not up to the standards of the journal, so they may reject it after that also. So how to avoid rejection? Nobody likes rejection, right? All of us, like many, I wanted to even to ask how many of you have faced rejection, but I did not, because that won't be a good manners to do it. So because of that. But even I have got a lot of my articles rejected. It's always a very sad and bad experience. You get a lot of anger and sadness and all. Next slide, please. So I am talking out of our own data, not out of my imagination, because we did an analysis of why we rejected articles from our journal, and we published it last year. So basically what I am talking today is the major reasons that we found in our own journal. Next please. This is our table of the major reasons. I will be speaking about the main ones. Next please. The most important one is lack of novelty. Basically all the good journals are looking for articles that advance the field. Like science does not evolve with some magical huge discoveries. It is always an incremental growth. One new study adds something new to the field, then another study comes which adds something more like that. So every good journal is looking for articles that are better than the previous studies on the topic, especially the good journals. Of course, there are low quality journals who will submit anything that has the structure of a paper, some p-values and tables and all. But the good journals, and depending on the impact factor and all, the extent of novelty they are looking for, that can keep varying. Next, please. I don't know about what kind of topics most of the people do their PhDs on in the field of psychology, but in psychiatry I know, in most of the, especially out of the premier institutions, when the MD students have to do their thesis, what they usually do in almost all the smaller centers is they have some fixed variables like quality of life, burden, disability, caregiver stress. Next, please. Then we have some of the illnesses that are common in our settings like depression, schizophrenia, bipolar, alcoholism, OCD. Next, please. Then they keep studying all the permutation combinations. In one batch it will be quality of life in alcoholism, next will be burden in schizophrenia, the next batch they will turn it around like that. So always the studying around the same thing again and again and again. So it is okay if you do that, you will get your degree and all, but if you want to get this published in a good journal, that is going to be difficult. Next, please. Other usual kind of topics that are not novel but are very commonly done, wasting a lot of time and efforts for everybody concerned, include internet addiction in medical students. Next, COVID-19 induced. It is for the past 2-3 years I have rejected hundreds of articles on these topics. Stress in healthcare professionals, burnout, depression, anxiety, sleep, all these kind of variables. No, please go back. Depression in various medical conditions. Unless you are doing in some very novel method and all, these kind of papers are not going to make it into any good journal. Next, please. So basically, at the outset itself, when you are before you are writing your protocol itself, you have to decide that you have to be ensure that the topic is novel. So you have to search the literature, as at least these two databases, to ensure that the study that you are planning to do is at least in some way superior to what has been already done. At least the latest literature that is available, be it in the terms of sample size, be it in the number of the quality of the tools used, etc., etc. Otherwise, you cannot expect acceptance by a good journal. Next, please. Now, one option is to do a study on a completely original topic, but I don't think that would be possible for most of us, right? To find out something that nobody has studied before, that is not going to be very easy. Next. So another option is there are already studied topics. Next. So you can what you can do is you can next please, you can do it if even if the topic is already well studied. Suppose the answer is still not clear. Now the previous studies have not been able to give a conclusive answer. Those kind of topics you can study again, and you can add to the confusion or add to or you can close the doubt forever or whatever. So you can do that. Next, please. Or what you can do is you can try a different approach. There have been previous studies, but you are using maybe a new tool, a new instrument, or maybe you are using a multicentric approach, etc., etc. So if you do this, even if the topic is already studied, the article may be novel enough for most of the journals. Next, please. And one tip I would like to give you is how to find out topics that have not been studied or topics that would be of interest to journals. There will be review articles coming on topics repeatedly. So what you can do is you check the latest review article, especially systematic reviews, and you check their future direction section. Because what they have done all the groundwork for you. They have done a thorough search of the field, and they have found these are the limitations in the existing literature, these are the things that have to be done. You just do that. And if you, in your introduction section, you highlight that this is what the systematic review said, and these are the limitations in the existing field, and I have overcome that in my study. Obviously, that is going to impress the editors and the peer reviewers. For example, next please. This is a review article on loneliness. It came in the journal Clinical Psychology Review. Next please. And in their limitations and future, especially the future direction section, what they said is that most of the studies have been from the self-report measures. And they say that future research may benefit from employing multi-method approaches, such as observational techniques and multiple informants. That is self-report as well as report from others. So if you have seen this article and if you do a study on loneliness and you collect the data from the person and other informants, and you highlight that in the introduction section, then you have a novel study that is advancing the field, that is superior to the existing literature on the field. That is how you find out a novel topic. Next please. And this dictum applies here also. Like it is not hard work, it is smart work. Especially one example, one way I would like to, to suggest to you is, look for something very new that is happening. Because novelty is always relative. As I told you, if you are going to study quality of study, quality of life in depression, it has been studied thousands of times. But if the concept itself is new, then whatever you study is going to be new, right? Especially when the COVID came, in that very first issue we published after that, we had about 4 studies on the stress. Online surveys, not very good quality studies, but online surveys done on stress among public, among health professionals induced by COVID. But only in the first issue. After that, the novelty is lost. So those people who started those studies immediately after COVID broke out, they got good number of publications in good journals and a lot of citations. But those who waited for 2-3 months, they lost the rest. Another personal example I would like to give is when I was a senior resident in CIP Ranchi, one of my students approached me and told that we can do a study on metabolic syndrome. That is basically the psychiatric medications cause obesity, diabetes, hypertension, cholesterol issues and all. I told him that, but this has been already studied. But he told me that there is a new definition. Next, please. He told me that